Good evening, everyone, and welcome to another Monday Night Live. It is 6 o'clock, and it is great to see everybody, and welcome, welcome. So I do these every Monday, give or take a little bit, and we are adding new topics, and we used to do these exclusively on Facebook. Facebook only holds 30 days of videos now. So we have gone ahead and moved our videos so they are parked on YouTube. So our YouTube channel is our company name. So we are uploading our videos that were on Facebook. And of course, we stream every Monday at 6 o'clock. And of course, this is an opportunity for you to ask questions real time as well. And I cover a wide variety of topics, and you can see our archive video there on our channel. So welcome, welcome. For those of you that don't know who I am, let me take a moment and introduce myself. My name is Laura Betts, and I am founder of Hyperbarics RX here in Fort Lauderdale, Florida. And tonight's topic is dosage, duration, frequency, and series, understanding ANDI Hyperbaric Protocols. So the hyperbaric industry is growing a little bit faster than the education. And not everybody in the industry is someone like myself that has a 40-year career in diving and hyperbaric medicine. I started off in I started diving when I was 12 years old. So, and I was swimming and on scuba and snorkeling many years before that. So I'm not new to hyperbarics. I'm not new to scuba diving. And I started out as a mixed gas diving instructor and ended up through my own personal healing miracle with hyperbaric oxygen therapy. That's what led me to found this clinic. And so as hyperbaric is growing, there's a lot of misinformation out there. And there are a lot of people that they may be well-intentioned, but they're not educated and they're not experienced. So this is one of the reasons why when you're choosing a hyperbaric facility, you really want to make sure that they know what they're doing, that they're an ANDI certified hyperbaric facility, that they're following proper protocol. If the protocol isn't right, it never creates the opportunity for efficacy. And I'm really passionate about that. I'm here, I'm alive because of hyperbaric oxygen therapy. If it wasn't for HBOT, the tumor in my right breast that was larger than a golf ball would not be gone. And in my personal story, that's how I transitioned from diving medicine to hyperbaric medicine. And because I was a mixed gas diving instructor, I had access to a hyperbaric chamber. But not everybody had access to a hyperbaric chamber. And this is part of the reason why I founded this facility down here in Fort Lauderdale. So again, welcome, welcome. So I want to give you an understanding of what a proper hyperbaric protocol is, because the goal here is to create an opportunity for efficacy. I'm doing a lot of consults now. And I sit on a couple of medical boards. I'll share that with you in a moment. I'm doing an awful lot of consults. And unfortunately, in many cases, the consults, they were excellent candidates for hyperbaric oxygen therapy, but either they were doing something else, they thought they were doing hyperbaric, and it turns out they were actually doing a different modality, or the dosage, the protocol did not create the opportunity for efficacy. So my goal here for tonight is to arm you with knowledge so that you can take an active role in your health and wellness, so that you can be more informed when you're choosing your hyperbaric facility. Now, again, as I mentioned, I am founder and facility director of Hyperbarics RX down here in Fort Lauderdale, Florida. Now, we do telehealth and consulting all over the world. So if you're not down here in South Florida and you're listening to what I have to say and you're going, wow, I really wish you could help me, I can. So please reach out to us. We do telehealth cases all over the world. We use a form of applied kinesiology called quantum nutrition testing. It's a tool that we use to personalize our natural health programs, and they make an incredible difference. We've had some amazing results. I've talked about some of those case studies in the past. Of course, I'll be sharing more of them with you as well. I am a longtime member of the ANDI Diving and Medical Board. I'm also Vice President of Substance Abuse Programming and Protocol Integration for the International Hyperbaric Medical Foundation. And again, The Hyperbaric Medical Foundation is working to expand access to hyperbaric oxygen therapy and what it is able to be used for, what it is effective for in relation to how people are using it. Real disconnect there. Now, our facility, we are located on West Commercial Boulevard in Fort Lauderdale, but again, we do telehealth all over the world. We are the first and only holistic hyperbaric center of its kind. I pioneered something called Foundational Hyperbaric Medicine, and we're using a unique combination of modalities to create an optimal opportunity for efficacy. And of course, what we're doing here is free from negative side effects. So and it's a very big difference about natural health care in general. It doesn't make you worse in order for you to hopefully be able to get better. Now, I am speaking at a conference this year. So again, I had the privilege of being able to speak at Quantum Leap last year, and I'm going to be speaking at Quantum Leap again this year. And the Quantum Leap 2025, we're coming up. It's October 3rd, 4th, and 5th, and there are still some tickets there. So there's a link to more information about that, and there's a discount code for you. And I want to take a moment and just show you a video and share some neat footage that we
factor on the way we heal. And these group of people, they definitely have the right intention.
It has been amazing to be here at Quantum Leap. I highly recommend it. It is so transformative, and it has done so much for me personally as well as my practice.
Masterminds and the VIP lunches, the vendors here are really aligned with 100% what Dr. Palmer is doing with Quantum Leap. Your next step is to book right away, don't wait, and you'll be thankful for the decision that you make.
So again, I really look forward to seeing you all at Quantum Leap. I'll be presenting some information on concussion and hyperbaric for neurological repair. So again, welcome, welcome. Now, Hyperbarics RX is an ANDI Hyperbaric training and research site. Again, if you're listening this on the replay or joining us for the first time, we are South Florida's oldest hyperbaric facility. So we're the only ANDI facility. And again, along with tonight's topic, it really matters. So hang in there and let me break it down and talk about some of the different things. All right, so let me get into our topic tonight and talk a little bit here. And let's get into it, and let's talk about a proper hyperbaric protocol. So if one hyperbaric session fixed everything, that would be great. But we're not resolving a chronic condition that in some cases was decades of lifestyle and environmental exposure, as well as nutritional deficiencies, and in some cases, some very poor health choices that led up to the problem. Symptom management doesn't address the underlying root cause. And as symptoms have Band-Aids put on them to cover them up without handling what's really happening, eventually the symptoms get worse and worse and worse. And usually by the time somebody is coming to hyperbaric oxygen therapy, they've got a challenge, they're dealing with a chronic condition. In some cases, this has been something that they've dealt with, or they've had some type of event like an accident, like a head injury, like a surgery, and they're looking for hyperbaric oxygen therapy to allow their body to heal fast enough before it turns into a chronic condition. So what's happening in the industry right now is a lot of misinformation in regards to protocol. Now, I've talked about how dosage dependent many of the hyperbaric mechanisms are. Depending on what we're trying to do, the actual dosage, the amount of oxygen that's being delivered varies. And dosage in the ANDI system is regarded as PO2 at bibs. So that's an abbreviation for the partial pressure of oxygen at the built-in breathing system. It's not just the pressure. It's the amount of oxygen, the partial pressure of oxygen that the person is breathing. In some subspecialties, they'll refer to it as inspired amount of oxygen, or the IFO2. Again, in the ANDI training system, it's called PO2 at bibs. That's the partial pressure of oxygen at bibs, and that's the dosage. Now, when you hear a number like 1.5 ATA, that's not pressure. That is dosage. That is a partial pressure of oxygen. And this is one of the reasons why you'll be working with an ANDI certified hyperbaric facility. And this is a reason why you want ANDI certified chamber operators. In order to deliver dosage requires equipment specific training. So the dosage is the amount of oxygen that the session is delivering. It's the level of the gradient. It's the pressure differential, the partial pressure of oxygen that the chamber operator is creating the opportunity for diffusion. It's the dosage. It is the amount of the drug. So pressure and dosage are not interchangeable, and many hyperbaric conditions treat at varying dosages. In fact, if the dosage is wrong, it may never create the opportunity for efficacy. Now, one of the things that's getting played on right now is that our body does use oxygen for just about everything. And we even have some published clinical data that's demonstrating that even a deficient dosage, meaning that the dosage was really, really low, but they did get something, even a deficient dosage for certain types of repair, most commonly neurological repair, may have some positive benefit. But I would argue in those cases that they were above average candidates to begin with. And if that's the results that they saw at a deficient dosage, what would we have seen at a clinically researched, a clinically documented dosage? So treating a wound is not the same dosage as treating a brain injury. It's not the same if we're dealing with infection. It's not the same. Concussion and sustained neurological repair, like a traumatic brain injury, they have two different approaches. They're doing two different things. So one of the reasons why you want to come to an ANDI certified hyperbaric facility is because we have all of these different protocols. ANDI hyperbaric facilities have access to the ANDI protocol and research list. And some of the indications are international indications. ANDI is an international organization. They have presence in over 60 countries, and they've been around for almost 40 years. So in some countries, there are hyperbaric indications that are cleared, meaning they're covered by insurance, they are paid for by state-funded, government-funded, they're paid for through health services. And other countries, these indications are not what we call a cleared indication. And in those cases, the health services don't pay for them. In the United States, our insurance doesn't pay for it, but it doesn't necessarily mean that you can't access it out of pocket. And that's where people are getting a little bit lost, because when it is a private cash pay, when they're doing it electively, how do they know that they're working with a facility? Where'd this protocol come from? Even when it's a doctor, well, where'd the doctor get the protocol come from? Is it based on research? Is it based on outcome? Did they just make it up? I've done other videos that talk about how some sites treat everybody at the same dosage. And again, these mechanisms are highly dosage dependent, and there are varying protocols depending on what the outcome is. So in a proper hyperbaric protocol, the first thing is we need to have the right dosage, and that dosage may change. So for example, when we have somebody with a head injury, the initial protocol for the concussion is going to be at a much higher dosage than when we move into neurogenesis, neurological repair. And again, a lot of research behind that. Now, dosage is the amount of the drug. It's the partial pressure of oxygen. The next piece there is duration, right? So how long are we receiving this dosage? Is it a minute? Is it 2 minutes? Is it 10 minutes? Is it an hour? Is it an hour and a half? Now, some of the hyperbaric mechanisms are only on at the target pressure. This is really true in cases of infectious diseases. So I've done a video, it's up on the YouTube page, about the differences between bacteriostatic and bactericidal. And I've talked about that. And hyperbaric oxygen therapy should always be bacteriostatic no matter what. Doesn't make it grow, doesn't necessarily kill it. And at higher dosages, it becomes bactericidal, meaning it kills those that type of bacteria. It kills those bad critters, and it is one of the reasons why it's used in the treatment and management of infectious diseases. Now, again, the kill mechanism, when hyperbaric is acting as a bactericide, that switch is only on at the target pressure. So if we don't spend enough time there, we haven't created a optimal opportunity for efficacy. Now, I've got another video where I talk about how long is a 60-minute hyperbaric session. And I talk about the difference between run time and treatment time. So what I'm talking about here for the purpose of this video, the time at target pressure, it's not the entire amount of the session, it's the time spent at dosage, right? So in a proper hyperbaric protocol, we've got dosage, we've got duration. The next step in our protocol is frequency. Frequency is how often it's done. You could have perfect dosage, you could have perfect duration, but if you only do one hyperbaric session, we didn't create an opportunity for efficacy. Yes, that session was good, but in many cases, it didn't restore the healing mechanisms. It didn't overcome the oxygen insufficiency. It didn't restore the immune system. It's not enough. So hyperbaric protocols have a frequency. Now, depending on what we're trying to do here, that frequency could be once to twice a week. In some protocols, that frequency is much more aggressive, like 3 to 5 days a week. In other protocols, the frequency is more than once a day. Concussion protocol, the initial series it's got a frequency, it's got an initial frequency of twice a day for the first portion of the series. So the frequency, how often are we doing it? It's usually per week. In aggressive protocols, it could be more than once a day. In hyperbaric oxygen therapy, some of these mechanisms are building on the prior treatment. A really good example of that is the anti-inflammatory mechanism. So hyperbaric, super powerful anti-inflammatory. One of the reasons why so many people benefit from it is because most disease, most chronic condition, just about all types of injury have an associated inflammatory response from the body. There's also a lot of things in our diet that are very inflammatory, like sugars and seed oils, and just by doing a proper clinical dosage of hyperbaric oxygen, we can dramatically reduce inflammation. Now, the anti-inflammatory mechanism, if you do another hyperbaric session before that mechanism runs out, it builds on the reduction of inflammation. So you can have where it brought the inflammation down, and then you add another session and it stacks on the session before, and we're able to resolve some pretty serious chronic issues by the frequency of the protocol. So again, you can have the perfect dosage, you can have the perfect duration, but if you're not doing enough of it and the sessions are too far apart, it doesn't create the opportunity for some of the mechanisms to build on each other. And in the ANDI protocol list, we have very specific protocols. These protocols are determined by the ANDI Medical Board, and these protocols are based on clinical research, and they are fed out to the research sites. Now, Hyperbarics RX happens to be one of the ANDI training and research sites, and the training and research sites feed back data real time, and we're able to establish, albeit in some cases anecdotal, the model appears to be efficacious. So again, in this scenario, we've got a large data model, albeit some of it anecdotal. The ANDI protocols, some of these protocols have been used for decades. So we know that they work. Now, yes, in a lot of cases, more research is needed. There are certain areas where we know we've got a dosage that works. We know we've got a protocol that works, but we don't necessarily know if it would be beneficial at other dosages. Again, great area where more research is needed. But again, we've got really, really solid information here, and there's a lot of experience as well as real-time application determining where these ANDI hyperbaric protocols come from. Now, the last step in this, so we've got dosage, duration, frequency, and then the last step in this is series. So how many dives per block? Very often, they didn't do enough hyperbaric. Now, some of the reason why that happens is because the dosage and duration is not appropriate. And if the dosage, duration, or frequency is not appropriate, the person may not be able to do enough hyperbaric. It doesn't, in order to get efficacy. And I'll tell you something else that is something that's a little frustrating for me. There is an attitude that's going around. We were at a trade show last year, and we were speaking with some of the hyperbaric vendors at the trade show. And in discussing the dosage limitations of one of the products that they were offering, it's a 2 ATA chamber. All of the chambers we have here are 3 ATA working pressure chambers. And we were discussing that for what we need here, while the equipment certainly has nice cosmetics, it's not able to deliver the proper dosage that we would need. And the comment that was made back to us was, well, that's good. They'll just need to do more sessions. And again, the business of hyperbaric as a profit center is growing much faster than the research and education. And that model is based on number of sessions. It has nothing to do with efficacy. They're not research sites. They have no skin in the game. And it's a volume model based on high turnover. It's not based on creating a long-term relationship with someone. It's not holding someone's hand through their healing journey. Very, very different than what we do here. So series is how many dives per block. And again, if we don't do enough of the hyperbaric oxygen therapy, we're not creating enough of an opportunity for efficacy. So for example, the traumatic brain injury protocols, the common block is daily, and it's done 5 days a week for 40 sessions, which comes out to be 8 weeks. Now, for some people, they need to do more than 40. After they complete the series, they need to do another series depending on the severity of the injury. A elective surgery protocol is very commonly 10 hyperbaric sessions. So they're doing their elective surgical procedure. Usually they're doing 1 to 2 hyperbaric sessions before the procedure for surgical preconditioning. I've done a video talking about the benefits of that. And then somewhere around 8 to 9 hyperbaric sessions on the post-surgical side for accelerated wound healing and infection. The hyperbaric stacks really well with the antibiotic and helps to reduce infection. So it helps to improve the outcome. And of course, hyperbaric is a pretty effective tool. It's used in the treatment and management of some pretty nasty infectious diseases. So when you're combining that with an elective surgical procedure. Now, chronic conditions, they may have a longer course of therapy where it's a couple of times a week over a course of 2 to 3 months. So again, we've got dosage, duration, frequency, and series. And all of these together make up a complete protocol. So again, as a review, dosage, that's PO2 at bibs, that's the amount of oxygen you're breathing, that's the gradient, that's the difference. Duration is how long we're spending at target pressure. And again, it matters. Some of the switches that are on in the body, some of the mechanisms of action, they are only on at the higher target pressure. So if the runtime is not appropriate to accommodate the treatment time, then again, we're not creating enough opportunity for efficacy. Frequency is how often. Again, hyperbaric sessions are commonly done once to twice to as many as 5 days per week. When we're dealing with something aggressive, something acute, the frequency could be daily, and some protocols actually have more than one hyperbaric session to them. Again, the industry, in some cases, they treat everybody at the same dosage, same duration, same frequency, same series, and it's just not what we see in the research. It's not what we do here at an ANDI certified hyperbaric facility. It's not the way a medical board approaches proper hyperbaric. And then our last piece, again, series, how many dives per block? The healing mechanisms are cumulative, and to some extent, time takes time. Neurological repair, for example, is a good example of slower healing tissue. So again, when we don't have enough dives in the block, when we don't have enough series, even if we had good dosage, duration, frequency, we didn't do enough hyperbaric in order to get the efficacy we were looking for. And that, by the way, is one of the reasons why we offer the type of programs that we do here. So we've got discount dive packages and wellness programs, and they're designed to help you rebalance your health naturally. And we're using a combination. We're doing something called Foundational Hyperbaric Medicine here. Again, it's approaching it from a root cause perspective, as opposed to using hyperbaric oxygen therapy, for example, to heal wounds. Well, yeah, it's going to work great to heal wounds, but what caused those wounds? Right? When somebody's body is so compromised that it can't make new cells, that it's got circulatory insufficiencies just as a consequence of the normal lifestyle, well, what's causing that? What's happening there? So again, in a lot of cases, while oxygen is the primary component and the body will heal undergoing courses of hyperbaric oxygen therapy, the goal is to address the underlying root cause, remove the stressor, and get the body healing. So again, we offer all sorts of different programs in order to help you rebalance your health naturally. I do also want to mention that we are an ANDI certified hyperbaric facility. You've heard me say it a few times, and there really is a big difference. The hyperbaric industry, because most of the people that were doing it were inside industry professionals. They were coming from military. They were coming from mixed gas diving. They had a healthy respect for the modality. They were educated and trained. So there were a lot of practices that we would never do, because in our knowledge and our experience, we would never take that kind of risk, not just with the occupants' lives, not just with the person inside the chamber, but it's harmful to us. It's dangerous to the operator if the equipment is not safe. So for a long, long time, the hyperbaric industry has lots of regulation. We don't need more regulation. It's got a ton of it. But for a very long time, there was little enforcement, because enforcement is reactive, and there were so few issues. There were so few problems. It was very, very rare in the safety and efficacy tracking of hyperbaric medical devices. It's surprising how few incidences there are in comparison to the amount of oversight and the scrutiny that hyperbaric sites are held to. Now, what's happening is the industry is growing much, much faster than enforcement can keep up. And as a result of that, unfortunately, in a lot of cases, the good news is the person doesn't get hurt, but the bad news is that the protocol didn't create an opportunity for efficacy. So they really didn't get helped. And when we're paying out of pocket, that's something that I'm really sensitive to. Having had a personal miracle with hyperbaric oxygen therapy, hearing that the ability, there wasn't enough oxygen there for that to even be on the table, I'm really sensitive to that. So again, some really big differences there. And it's another reason why you want to go to an ANDI certified hyperbaric facility. It means their staff is trained. Not only are our chamber operators certified, we're trained and certified for the exact equipment systems that we're working with. Now, we've got five PVHO ASME monoplace hard chambers here at Hyperbarics RX. I've talked a little bit about that in some other videos. And of course, I encourage you, if you're interested in doing some hyperbarics with us and you're local, well, come on out and check out a facility tour. We have a beautiful facility here, and we'd happy to show you some of the differences. In addition to protocols, we're following well-established safety procedures. We're following established protocols. Who's making it up? We're not just making it up. There are a long history behind the ANDI Hyperbaric Protocols. Again, if you're not an ANDI certified hyperbaric facility and you're lost, we'd love to hold your hand and help you. And if you are looking for where to do hyperbaric, come on out to Hyperbarics RX. Again, we are an ANDI certified hyperbaric facility. It's an extensive voluntary accreditation process, and it means an awful lot. One of the things that's distinctly different about ANDI certified hyperbaric facilities, ANDI as an organization, we're working on, as of the date of this video, we have over 35 years of perfect safety. There's never been an incident in an ANDI diving facility, never been an incident in an ANDI hyperbaric facility. So safety is our main concern, and we have a long history. ANDI as an organization has a long history of good procedures and good practices that continue to produce optimal outcomes paired with optimal safety. So again, I hope I gave you a little insight into what a proper hyperbaric protocol is. Now, again, if you're listening to this, if you're lost, if you're dealing with symptoms, if you did hyperbaric and you didn't get results and you thought it was really going to make the difference, please reach out to us. We offer a comprehensive consultation. It's very extensive. This is available to our in-person clients as well as our telehealth clients. Our comprehensive consultation is a two-part appointment. So the first part of the appointment, we're going to take an extensive medical history. We're going to do a non-invasive organ and gland scan looking for areas of the body that are out of balance. We also have the ability, we work with certain tox panels here. So depending on what your particular health journey is, we may feel that it's appropriate to use some diagnostics like a toxin panel, like a neurotransmitter panel, like a hormone panel. There's a lot of different tools that we have here. One of the tools we work with is a one-time DNA analysis. Again, a lot of people are doing very good things, but are they doing good things that are right for their DNA? We all have very specific nutritional requirements. And again, eating too much of a thing that we don't need isn't going to translate to an optimal health outcome. So again, tons of tools here for you with it. After that first appointment, on the second appointment, we're going to put together everything that we found. We're going to tell you what areas are out of balance. We're going to give you a written report of findings with everything that we found, and more importantly, how we're going to fix it, including all costs. So it's called our comprehensive consultation. We offer specials on it, and I encourage you to reach out to our office for more information. So again, I hope I gave you some good data tonight and give you insight into a proper hyperbaric protocol. So it's amazing to see everybody. We do lives every Monday at 6 o'clock, and you can find our videos stored on our YouTube channel. And again, our YouTube channel, we've moved our videos. They're only on Facebook for about 30 days. So our videos now, you can find them on our YouTube channel, which is our company name, Hyperbarics RX, and we encourage you to like and subscribe. Again, we look forward to seeing everybody at Quantum Leap, and there again is that discount code. There are some still tickets available, and Andy will have a booth at the Quantum Leap show, so we look forward to seeing you guys there. Again, as always, it's amazing to share information. My name is Laura Betts. I am president and founder of Hyperbarics RX and facility director, and I am a natural health care practitioner. I'm really passionate. I can only help you if you let me, so please reach out to our facility. And again, it's been amazing, and I look forward to seeing you live next week. So if you're listening to this on the replay, thank you, and it's been a pleasure, and I will talk to you again very soon. So have a great evening, everybody. Good night.